It is my real pleasure to introduce to you today Dr. Simone Tomasi, who is an attending psychiatrist at Mount Sinai Hospital Medical Center, just down the street from the Center for Human Reproduction, and my old training ground many years ago as a resident in obstetrics and gynecology. And Dr. Tomasi heads up so-called black dog psychiatry and is quite involved in the field of IVF and its psychiatric relevance, not only professionally, but also because his wife is an excellent embryologist. And so it's my special pleasure to have him here today, giving me the opportunity to ask a lot of questions, some of which even I am very interested in hearing the answers to. So welcome, Simone. And let me start with my first question.
Thank you, Dr. Gleicher. It's a pleasure to be here today. Thank you for inviting me.
My pleasure. So my first question is, why are words people use after they lose a pregnancy so important?
Yeah, that's a great question. And I think it's important to start by acknowledging that pregnancy loss, it's a huge psychological toll on affected couple. It's not just, and we're going to talk about that, it's not just the loss of a pregnancy, it's loss of a future they had imagined with their baby. It's the identity of as parents. So a lot of people feel like their loss, it's not just devastating, but sometimes it's just also unseen. Their grief is invisible. In a way, this is something that society doesn't always recognize. So obviously, language is communication is something that can help acknowledge that pain, that emotional pain, can be very important to validate and recognize the importance of an experience that people have gone through. So obviously, we're going to talk about the right way, the best way to approach a conversation. But the first thing that I would start to acknowledge is that it is important to give a sense of that experience. As in everything, in psychiatry, we always encourage people to be connected emotionally with people. So in this case, it's the same. The language is the communication words we use are an excellent way to get connected emotionally with people in need.
Okay, that makes a lot of sense, and I couldn't agree more about the trauma that every miscarriage brings. In fact, it is what I call a double whammy, because this is now they have not only the trauma of not being able to get pregnant, but on top of it, the loss of the pregnancy. Okay, what kind of comments do you think are most harmful, even if they're well-intended, I would assume?
Yeah, I think you're touching on a great point, and I'll start by saying that most of the time people mean well. They're really trying to provide comfort and support, but the reality is that sometimes certain phrases just land in very painful ways. I've seen a lot of times well-intentioned comments really backfire, saying things like everything happens for a reason, or just minimize it by saying something like it wasn't meant to be. Obviously, the goal is to encourage people to provide support and psychological support for the situation. But what the parents actually hear is you just don't feel sad. Again, it's not validating their experience. It's a sort of in a way, spiritual or even philosophical shortcut that sometimes we use. And the reason why we do that is because we have our own reaction to their loss. Sometimes it's difficult for people to have their own engagement because they face a level of pain and grief which is hard to acknowledge, and then sometimes our words reflect our own inner reaction, psychological reaction to that, rather than acknowledging the pain that people are going through.
Yeah. And on the flip side, what are some of the words or phrases or gestures that can actually provide comfort to our patients? What what should we say and do?
Yeah, I would say that the most important thing is like trying to be authentic, and meaning like, you don't have to come up with a perfect line. There's not like such a thing as like a best phrase to say in that moment. Most times, the most powerful things are like the simplest, like a heartfelt "I'm so sorry for your loss." That goes a long way. Or even, sometimes just acknowledging that, you don't know what I don't know what to say, but I'm here for you. I wish I had the right words. Just be sure that, I'm available, I'm there, I care. Those kind of words, like, don't try to fix anything. They just acknowledge the grief and offer, like, presence, which is, as we'll say later on, the most important part is just sometimes not what we say. Sometimes it's enough just to be there, silent, just being like a very respectful presence. Or sometimes actions speak more than words. Like, it can be helpful to people who have been going through like a pregnancy loss in many different ways, dropping off a meal, like sending a car, like running some errands. There's many different ways. So just think about like providing support is not just what we say, but the way we act to, to communicate that.
Loved ones have the same problems that we have, I would assume. Any suggestion how we could educate their loved ones to help them?
Yeah, so that's a great question, because also like the way people experience grief is obviously like, very different. There's people who like to talk about their experience like all the time, and there's people who are more private. And respecting each other is sometimes the hardest part, not just because we are, the person is facing the pain, and then sometimes it's too much to ask also to understand that other people express the same kind of grievance in different ways. So sometimes I guess just an open communication, just being very forthcoming about like, hey, I just can't talk right now, and maybe just give me some space. Or like sometimes writing down, like, texting, emailing people sometimes takes away the burden of telling what could be like perceived as a rejection. Sometimes just giving some space sometimes might sound like you're rejecting me. But other times it's important for everyone to acknowledge that they need their own space and they need to set boundaries. Sometimes that's the reality, is that there's no right or way or wrong way to grieve. That's the way you feel comfortable. And sometimes the best support we can offer people is to create those conditions where a person feels safe and supported. And it's very hard. I give it absolutely very hard.
Is the grief following pregnancy loss different from other grief?
Yes, like I mentioned before, it's a very complex feeling, because first of all, oftentimes is invisible. Like, as you know, a lot of couples go through this path, like, keeping it like, just secret, or just keeping for themselves. They don't like to share about their ongoing attempts with friends. So sometimes having to deal with a pregnancy loss is something that people were not even aware they were trying to achieve a pregnancy. So now I have to tell you that I was going through that,
Yeah.
and unfortunately didn't work. So it's a double hit. In addition to that, it's the idea of the imagined future that is going away. Parents, sometimes they grieve birthdays that will never come. They will think about first days in school, or milestones of a life that all of a sudden they start to imagine it's part of their new life, their new identity as parents, and all of a sudden that's taken away. And again, people are not even aware. It's like, in that sense, it's something that we sometimes refer to as like a disenfranchised grief, because the society does not recognize that, does not have a space for that. Most of the time you tell people about, oh, I had an abortion, people say like, yeah, I know, well, that happens. But you you may not know what's behind that, what's the story, what's the experience of a of a couple going through that.
We also need some help. But what do we what do we tell our patients in those situations, how they can honor their grief while also protecting themselves from getting insensitive comments from their
Mhm.
environment?
Yeah, I think that's an excellent question, because it touches on the most practical aspects of like everyday life.
Yeah.
How do we deal with that? How do we protect ourselves from that situation and from the consequences of that? So sometimes, it's important to acknowledge and give ourselves the credit that, you're in a time of your life where you actually need some space to protect yourself. Not everyone around us is able to hold it well. So sometimes we may just need to, create a safe space. Like sometimes I recommend people to have like a safer circle of people where you have like maybe one or two friends or like close relatives that are aware of what you're going through and sort of like are mediating like, relationship between you and the rest of the world, like, helping you or like letting people know how you're feeling, giving them updates so that you don't feel like you don't want to talk to people. But at the same time, it's important to also educate, like also ourselves, like clinicians, the way we talk about patient, the way we acknowledge like that loss. Sometimes for us could be just like a minor setbacks, but for intended parents can be like a huge loss. And as you know, in your work done for many years, it's every situation is different, and then you have to be very like empathetic. And what does that mean? It's something which is very hard to teach people. It goes by like trying to establish a deep emotional connection and trying to meet the person where they are right now. And if it's a phase of grief, so that's important to acknowledge that space is needs to be protected as well. A lot of times people are afraid of like setting boundaries, but it's important. Sometimes I teach them like there's a couple of sentences, things that you can say like, I appreciate your being around, but I need my space right now. So that creates some boundary and some safety also for the couple.
We both practice in New York City, where there are so many different nationalities
Mhm.
amongst our patients. On top of it, the Center for Human Reproduction really serves a worldwide patient clientele. What are the cultural differences that we need to consider?
Yeah, that's a very important point, especially like living in a place like New York City, which is very multicultural. It's important to understand and acknowledge that grief is not like one size fits all kind of thing. And culture plays a huge role in how it's expressing not just like your culture, but maybe your family tradition, your personal beliefs. It's important to know that it goes case by case. In some cultures, there are some very clear rituals for loss, like ceremonies or like prayers or like public memorials that sort of like give the community some space, some opportunity to participate and to hold the grief together. But in other culture, that's not what they want. Like pregnancy loss may be kept very private, even hidden, which some parents feel like it could be even more isolating and may also create some misunderstanding with people around. So it's always important to explore what is the expectation, what is that I can do right now to make that person feel well, and also in a cultural perspective, would that be appropriate to show up and just bring a gift in a moment where maybe that's not appropriate for their culture, maybe that's a moment which they want to honor in a very private way. So thinking about that, I think is the first step, is just asking yourself that question, like, how can I support this person in this phase of their lives, and what should I consider next?
A related person. We very frequently find that our patients have a family member who they trust more, who they ask for help more. And we also find ourselves kind of developing a relationship with that helper.
Yeah.
Uh, what should we tell those people, how they can help those patients in overcoming those losses?
Yeah, it that can actually be one of the hardest part, because when you're grieving, you may not have like the energy to manage other people's reaction in that. So, but it's completely okay. Actually, it's very healthy, and I recommend that to set boundaries very clearly. So something that people can do is be prepared, having like a few short phrases that you can use so you're not caught off guard. Something like thank you for checking in. I'm not ready to talk about this right now, or maybe I can talk a little bit, but then if you don't mind, we'd like to switch to something different, or appreciate your support, but I just don't need advice. It's important to sometimes communication done in writing, like sending like a group email or a text, or even, as I mentioned before, like asking someone sort of like to pass along your wishes is important. Also, because there is one practical aspect, you don't want to repeat over and over again the same story to different people, because every time that your pain release and is triggered. So also, like, boundaries doesn't mean that you're saying no. It just means that you're asking for some space and you're telling people exactly what you need in that moment. So you don't need to justify yourself or explain why you want to set boundaries, and it's important just to put yourself in the first place, give priority to your own well-being in that moment.
Are there rituals or memory practices that you would recommend?
Yeah, absolutely. Like, some rituals can be incredibly healing, because they give shape, expression, they give voice to grief that otherwise, could feel invisible. For many parents, there's no funeral, there's no public acknowledgement. So having those rituals can be actually a way of saying, like, these actually matter in my life. It can be many different things. Like, it can be like, lighting a candle, or on meaningful dates, some people like, to plant a tree, or like keep a piece of jewelry, or like a keepsake that symbolize their baby. Some people like to give names, and just writing letters to them. Even it's something that, these are like little gestures that don't erase the pain, but they create sort of like a safer container for it.
How do you feel about patients who want to do a burial? Is that um, still within what you would consider to be an appropriate framework, or would that appear a little excessive and maybe should lead us to recommend counseling?
Um, I wouldn't necessarily consider any choice as problematic. Like, if the person feels like that's what they need, in a way, for a lot of people, is important to go through that step. Like, keep in mind that in our society, funerals also represents, like, symbolically, like a moment of like closure. So it's a phase which helps people processing the pain. So going through that phase sort of like puts an end to a story, like, but that's the beginning of a new chapter. And that, it's a moment of passage, like a funeral, or like a burial, or like things like that can actually help with, if the person feels like. A lot of people would feel very triggered by something like that. So it goes case by case, and as long as there is consensus about like what is helpful for a couple, what they want to do, if it's like within their scope, within their personal values, so then I think they should be encouraged to mourn the way they want.
So let's assume that somebody who just experienced an unfortunate miscarriage is listening to us. What would you like them to hear most right now
Yeah,
in this acute phase?
that's a great question, and we can offer a lot of help by let them say that their grief is real, is valid, and is worthy of care, of attention. There is no timeline you need to meet. There is no right way to grieve. There is no something which is right or wrong. Everything is important, can be extremely helpful if it's within your own system of value. Healing, and also healing, as I mentioned, does not mean forgetting. It's, you don't need to be strong for anyone. It's a time of your life when it's okay to be weak and vulnerable. It's important to know that you're not alone in that process. There's people there can do a lot for you. Their presence can be extremely meaningful. There's people who feel like they can really take a lot of help from others, and sometimes they're just very hesitant because they don't want to be a burden for other people. So it's important to acknowledge like the huge complexity of, like, from the personal individual standpoint, from a cultural standpoint, from like a societal perspective. There's different layers, and it's important to acknowledge that it's okay to express your choice, make your decision about the way you want to record it, the way you want to talk about, if you want to talk about. And also, like, the most important thing is like reaching for support is not a sign of weakness. Actually, it takes a lot of courage. And sometimes the reality is that you may not be able to handle that all by yourself, or maybe the dynamic with your partner can change because of that. In a moment of high stress, things can be extremely volatile. Sometimes it's important just to acknowledge that and get connected with a mental health professional, whether it's a group, whether it's like an individual provider, whether you want to receive like talk therapy, as psychotherapy, or you think medication sometimes help because people are not sleeping, they are not functioning anymore. So we want to support that in any possible way.
And now for my last question, maybe some self-help. How can we professionals in reproductive medicine be more mindful in our language and in our first responses to a patient? This is such a frequent occurrence, of course, in infertility practice. It is something we experience almost every week.
Yeah, it is a very common outcome, unfortunately. And I think it's important to, first of all, acknowledge our own feelings about that. Obviously, as providers, as clinicians, we are, we have to have like a neutral stance, but the reality is that we are human beings. So we have like, a personal level of connection. We are affected in many ways by different people in many different times of our life. And it's important to acknowledge that we do react to that. We do have an emotional reaction to that situation. It's important to acknowledge that because you don't want that to interfere. A lot of people might feel like it's my failure. It's my fault. Like it's actually not. It's like it's something that happened, and it's important to just acknowledge that it's not just like a clinical setbacks. It's not just a failure. It's a person who is going through like a huge emotional experience in their, probably the most painful experience in their lives. Just sometimes keeping that in mind is important, because maybe instead of saying like in thinking about next steps, because as clinicians we're very focused about what happens next, what are the options, what are like what can we try next. Sometimes we just need to acknowledge that people need a little space. Exactly, they're not ready. They may want to reconsider some things, or some people may have the opposite reaction. They want to try immediately
right away.
In that case, it's important to maybe help them process that pain and just being like in a way supportive. But it's for us, it's the same, like acknowledging and being emotional, so being empathetic goes a long way. Saying things like, I'm sorry for your loss. It's the most powerful thing that sometimes we can say. We can use the word baby if that's what the parents prefer. Other people don't like that. And, we can slow down. We can create a safe space. Also, when there is a direct communication, like create a space for silence, for questions, for tears. Like sometimes we can do a lot, just like without saying necessarily.
Thank you, Dr. Simone Tomasi. I learned a lot, and I hope our audience did as well. Would you like to leave for our audience maybe the phone number to your office
Yes.
On concluding this?
Yes, my practice, I'm launching my website, will be reachable online at blackdogpsychiatry.com. And my practice number is 914-912-0525. So happy to, be helpful and provide support the best I can. And thank you, Dr. Gleicher, for having me here today. I really like this conversation, and I think it's important for us to keep an open perspective, and for me, learning about what you, reproductive endocrinologists do, and how important it is sometimes to provide the best level of care. Also includes like, psychological support.
Absolutely.
ASRM is becoming more and more aware of this. They are having a lot of initiatives, and your practice is very aware of that, as you know. So it's great. Thank you for your work in the field.
And thank you for helping us. Thank you very much. Bye-bye.
Thank you. Bye.